Good morning everyone. Welcome to Whiteboard Pharmacist grade 2 competitive examination coaching classes. Okay. Before starting the session, I would like to announce you one thing that Whiteboard we got a very huge response for this Pharmacist grade 2 coaching classes, and from today onwards, from 20th onwards, we are going to start a fresh new batch. So for any details and any other queries, you can contact the number given below. Okay, I will display that at the end of the session. And let us start the paper discussion which we have conducted yesterday. Okay, so we will start the paper discussion and the answers. Okay, so let us see the first question. Which of the following is a secondary drug for the treatment of leprosy? Okay, so if you see the first option, dapsone. Dapsone is the first and foremost drug that is given for the treatment of leprosy. So this is not the right option. And if you see furosemide, it is a diuretic. Okay, it is not used for the treatment of leprosy. And sulphonamides is a anticonvulsant drug. Okay, so this is also not the right option. Okay, so only one option that is left is clofazimine. Clofazimine is used for the treatment of leprosy. Okay, and it is the secondary drug for the treatment of leprosy. Next question. Advantages of artemisinin based combination therapy includes all except. Okay, artemisinin based combination therapy, in short it is ACT. So the name itself indicates this is a combination therapy. Combination therapy means artemisinin based drugs, okay, artemisinin based drugs plus lumefantrine, okay, like and mefloquine. So artemisinin based combination means giving the combination along with this artemisinin based drugs. So artemisinin is given along with lumefantrine or mefloquine. This is called combination based therapy. The main aim of this therapy is to reduce the cause the parasitological cure. That means it cures the disease by 90%. Okay, so this is, see, it is advantages, all the advantages except. So this is an advantage, this is the right answer. Good tolerability profile, combination therapy will be having, one of the aim of combination therapy is to provide tolerability profile. So this is also the advantage. And high recrudescence rate. What is recrudescence rate? That is recurrence of the drug, disease. So combination itself one of the aim is to prevent the recurrence rate. Okay, that means recurring rate. Okay, so that means coming the disease again and again. So that has to be prevented. And one of the another aim is to prevent the resistance. Okay, so absence of parasitic resistance, this is the advantage rate. High recurrence rate is the wrong disadvantage. Okay, so advantages, all these are advantages except this one. So answer is high recurrence rate is the acceptable thing. All other options are advantageous options, okay, except this one. So the aim of this ACT or combination therapy is to provide good tolerability profile, is to provide prevent the resistance, provide the low recurrence rate, and cure, prevent cause 90% of cure. So this is the answer. Third one, C is the answer. Next question. Assertion reason type. Sildenafil causes impaired blue-green discrimination. Sildenafil is a PDE5 inhibitor. Okay, PDE5 inhibitor. Okay, sildenafil is a weak inhibitor of phosphodiesterase 6. Okay, the main sildenafil is also called as Viagra. Okay, this is a PDE5 inhibitor, but this is also having another use. It is weak inhibitor of PDE6. Okay, And if you see, the distribution of PDE6 is present in retina of eye, especially photoreceptors. So, PDE6 is present in photoreceptors, rods and cones, which are responsible for transduction of light. That means you can visualize the colors because of this photoreceptors, rods and cones that are present in the retina of the eye. If this is inhibited, okay, since the sildenafil is a weak inhibitor of phosphodiesterase 6, so the transduction, light transduction is inhibited. That is why when you use sildenafil, it causes impaired blue green color discrimination, because it is inhibiting PDE6, which is distributed in the retina of the eye. That is why the answer is both are true, and R is the correct explanation of A. Next question, which of the following drugs produce phototoxicity? Amiodarone, sulfonamides and phenothiazines. Okay, the sulfonamides so one of the side effect of sulfonamides is Stevens-Johnson syndrome, okay, and hypersensitivity reactions and also phototoxicity. Similarly, amiodarone also shows phototoxicity, and phenothiazine, which is a tranquilizer drug, this is also shows phototoxicity. Phenytoin, which is a hydantoin drug, anti-epileptic agent. This shows side effect Stevens-Johnson syndrome. So, you can also get the combination of question like this, which of the following drugs will show the side effect Stevens-Johnson syndrome? Sulfonamides and phenytoin, but in this case now phototoxicity. So, amiodarone, sulfonamides and phenothiazine, these three drugs will show phototoxicity. So, the answer is A. Next question, which of the following sulfonamide is a diuretic? So, carefully observe the question, see the options, all these are sulfonamides, all these are sulfonamide containing drugs, but each drug is having different activity. So, if you see tolbutamide, it is a sulfonylurea which is anti-diabetic, okay. If you see mefenide acetate, this is also a sulfonamide drug which is antimicrobial. Furosemide is also sulfonamide which is loop diuretic. Sulthiam is also having sulfonamide moiety, but this is anti-epileptic. So, if you see what is the option here, so which of the following sulfonamide is a diuretic, okay, furosemide is a diuretic. So, option is C. Next question, which of the following statements about glycerol is incorrect, okay. So, glycerol, if you see, it is metabolized to oxalic acid. No, it is not metabolized to oxalic acid. It is metabolized to either glucose or lactate or pyruvate, okay, depending upon the site of action, okay. So, next if you see glucose, this glycerol is hygroscopic in nature, it can depress the freezing point of water and it is a good solvent. So, all the three are correct, only incorrect one is it is metabolized to oxalic acid. So, the answer is 1. Next question, barbiturate is a, so if you see the structure of barbiturate, okay, this is the structure of barbiturate. So, there is no double bonds in the structure. So, If you count the number also, what is the number 1, 2, 3, 4, 5, 6. So it is 6-membered ring. All the options are 6-membered, 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 6-membered. 6-membered rings with saturated. So unsaturated wrong. Saturated ring with 2 nitrogen atoms, and 3 oxygen atoms. Okay. So this is the structure of barbiturate. So the answer is A. Next one, which of the following is called as picric acid? What is the picric acid? You know, picric acid, it is a highly inflammable, highly acidic, highly flammable, highly acidic compound, okay, picric acid, and this is used in the preparation of explosives, dyes. One more important use is picric acid, it is used in colorimetry. And what is the structure of picric acid? That is trinitrophenol. This is phenol 1, 2, 3, 4, 5, 6. So 2, 4, 6 trinitrophenol is the answer. Next, the GLP-1 agonist approved for weight loss independent of diabetic status. So if you see glucagon-like peptide 1 agonist, what is GLP-1 agonist? Glucagon-like peptide agonist. And whatever all the drugs, glutides, okay, glutide, okay, glutides. So dulaglutide, liraglutide, lixisenatide and semaglutide here. So these drugs are GLP-1 agonists which are active against diabetes, but in the recent times FDA have given approval for the use of GLP-1 agonists for obesity treatment also, okay, for weight loss treatment. So these drugs, independent of the diabetic nature of the patient, these drugs can be used for the treatment of obesity. So what are the drugs? Liraglutide and semaglutide 2 and 4. Liraglutide and semaglutide are approved by the FDA for the treatment of weight loss. So answer is C. Next question, which of the following is not a basic amino acid? So what are acidic amino acids and what are basic amino acids? So this is a side chain, if you see side chain, okay. If the side chain basic substituent or basic side chain is basic, okay, then then that amino acid is called basic amino acid. So arginine, lysine and histidine, all these 3 are basic amino acids, okay. Then aspartate and glutamate, aspartate and glutamate, these are acidic amino acids. So if you see here, odd man out, only one option is, because these 3 are basic, only one which is not basic is threonine. Next one, next question, matching schedules. So you have to concentrate on the schedules, each and every schedule is important, okay. So let us see now schedule Y. Schedule Y is for clinical trials. So schedule Y, requirements for clinical trials. FF, schedule FF, ophthalmic. You remember like that, ophthalmic, okay, FF. So ophthalmic ointments. Schedule O, disinfectant. Schedule O, disinfectant liquids. So let us see 3 is for R, 3R. So rest of the options you see. Three R is there, 3S is wrong, 3S is wrong, 3R is there. Schedule P is shelf life of drugs. So 4P. So this is the answer. 4S is wrong. Okay. So 4S is 2S is the answer. 2S, 4P, 1Q. Okay. Schedule Y is clinical trials. So option D is the answer. Next question, Aspirin is converted into salicylic acid in the body by which of the following reaction? So, whatever the questions for the pharmacist, okay, very basic questions and important questions. So, the concept will be very basic, but that basic is very, very important from the pharmacist point of view. The questions, everything will be like that only, with questions with some common sense. Okay. So, here also this is a basic reaction. What is the reaction that is happening? Aspirin is converting into OHOCOCH3. This is aspirin. Aspirin by hydrolysis, okay, it converts into salicylic acid, okay. Sorry. So, this is salicylic acid. So, the reaction here happening is hydrolysis reaction. So, answer is A. Next question, the structure of diamorphine offers from that of morphine by the addition of which functional group or groups? Okay. So, if you see, morphine in its structure will have two OH groups. Structure will be very complex. So, you just remember the groups that are present. Okay. So, morphine is having two OH groups. Diamorphine is nothing but heroin which is having two acetyl groups. Okay. That is the difference between morphine and heroin. Morphine or diamorphine. Okay. The difference is two OH groups, two acetyl groups. So, because of these two OH groups, the morphine will be polar in nature. Because of this, acetyl groups will impart non-polarity. The molecule is non-polar or lipophilic in nature. Okay. So, heroin is lipophilic in nature because of the presence of two acetyl groups. Next question. What kind of antibacterial agent is erythromycin? So, if you see, penicillin is a beta-lactam, cephalosporin it is having CPEM, tetracycline is having this 4 ring structure, okay, it is having substituents also here, okay, but erythromycin is a macrolide antibiotic, azithromycin, clarithromycin, erythromycin, okay. All these are macrolide antibiotics. So, the answer is A. See the next question, paclitaxel. Paclitaxel, also called as Taxol, which is used as a anti-cancer agent. Okay, this is an anti-cancer drug or anti-neoplastic drug. So, paclitaxel, potent anti-cancer drug, was isolated from yew tree. It is a Pacific yew tree is the answer. It is not Pacific, it is a plant source. So, not Pacific Ocean, it is not a fungus, it is not a bacteria, it is plant source. So, it is Pacific yew tree. Next question, compounds or groups having the same number and arrangement of functional groups are known as. See how basic good questions, okay. So, only you should have an idea about all the streams. So, the questions will be like this only, but you should not get confused with the options. The trick will be with the options only. Okay. So, chiral molecule means what? Chiral molecule means the compound around the carbon 4 different groups. Here same number and arrangement of functional groups. Okay. If you see the isomers same molecular weight functional molecular formula, but it may contain different physicochemical properties. But when it comes to the case of isosteres, same electronic properties will be there and same molecules. That is why isosteres is the answer. Diisostemers means non-mirror images, okay. and mostly 2 chiral centers will be there, more than 1 chiral center will be there. So, diastereomers. So, answer is arrangement of same functional groups and same number and same properties. These are answer is isosteres. Which part of the brain controls the heart? This is also again the most basic question. Medulla oblongata. Okay, don't get confused. Spinal cord, it is not neuron and none of the above. Okay, answer is medulla oblongata. Next question. Enzyme involved in catabolism of acetylcholine. So, name itself indicates it is getting metabolized in presence of acetylcholine esterase. Okay, acetylcholine esterase. So, rest of the options serine decarboxylase, no, acetylcholine, okay, it will be catabolized, that means it breaks down into choline and acetate in presence of enzyme acetylcholine esterase. Next question. 2-acetoxy-ethyl trimethyl ammonium chloride is the name of, so, ethyl acetoxy trimethyl ammonium chloride, trimethyl ammonium chloride. So, this is nothing but the structure of acetylcholine. Okay, it is not pilocarpine, atropine, bethanicol, it is acetylcholine, neurotransmitter acetylcholine. Next question, which of the following statement is true about the primary structure of proteins? So, primary structure of protein structure is having primary structure, secondary structure, tertiary structure, quaternary structure. Basic amino acid sequence in the primary structure, helices and beta sheets is the secondary structure, 3D structure or tertiary structure of the protein in tertiary structure, and subunits are studied in quaternary structure. So, now see which is the following statement is true about primary structure. The helical structure of the protein, primary structure, no. Helical structure is secondary structure. Subunit structure of protein, no. Subunit structure is quaternary structure. 3-dimensional structure, no, it is a tertiary. So, sequence of amino acids joined by peptide bond, that is the primary structure of protein. So, answer is D. Which of the following is an example for trisaccharide? See, all the questions are everything are just the classifications, examples and basic structures and basic uses. Okay. So, here see example of trisaccharide. For fructose is a monosaccharide, sucrose and lactose are disaccharides, oligosaccharides, raffinose is a trisaccharide. Answer is C. Okay. So, focus on the classification of the carbohydrates and their examples and their properties, very very important class. Next question, rights of medication include the following. Okay. Rights of medication includes right to assessment, okay, right to assessment, then right to dose, right drug, right documentation, okay, right education, right right time, right patient, right response, okay, right reason, okay, and right route. All these are almost 10 rights of medication except gender. Drug is there, patient is there, route is there, gender is the not a right to medication. So, answer is C. Next, match the following, very important, focus on the different kinds of classification of drugs, like lipid containing drugs. So, what are the chemical tests that are used to analyze the lipids? Alkaloidal tests, carbohydrate tests, glycoside tests, lipid tests. So, all the identification test names are very important, and the reagents that are going to use are also very important. So, one question on this, if you see here, 𝐓𝐞𝐬𝐭 test is for cardiac glycosides. Okay, 1:2. No, see. Okay, cardiac glycosides like digoxin, okay, are analyzed by 𝐓𝐞𝐬𝐭 test. Anthraquinone glycosides is for Born-Traeger test, like senosides, amodin. Okay, these are analyzed using this Born-Traeger test. Foam test is saponin. 3 is 4. Okay, yeah. 1:2, 1:2 option. This wrong. 1:2, 1:2. These 2. 2 is 3. 2 is 3. No. Yes, this is the option. Foam test. 3 is 4. Yes. Saponins are analyzed by foam test. Shinoda test is for flavonoids. Flavonoids like quercetin. Okay. Quercetin, myrcetin. These are analyzed by Shinoda test. So, 4 is 1. So, this is the right option, C. Okay. Next question. USP surgical cotton is officially purified cotton. Okay. Next option. Hyperglycemia, glycosuria, hyperlipidemia are the symptoms of. So, name itself indicates hyperglycemia means increased levels of sugar. So, that is nothing but hypertension. See, hypertension, nothing but diabetes. Hypertension is the option, diabetes, jaundice, none of the above. Answer is glycosuria, hyperlipidemia and hyperglycemia. So, it is diabetes. Next, if the adult dose of drug is 80 mg, then the dose of 8 years old boy should be. So, you can use different formulas for calculation of the pediatric dose. So, Dilling's formula you can use, Young's formula you can use. In this case, why? Because it depending upon the data you have. So, here you have the data of adult dose and dose of the age of the child. Okay. So, using Dilling's formula I am using here to calculate, because with this only you can, because Dilling's formula is age of child into adult dose divided by 20. Age of child here is 8 years into adult dose is 80 mg by 20. So, answer is 32 mg. So, Dilling's formula is used to calculate the pediatric dose when you have the data of about only adult dose and age. Okay. So, if you have weight, data of the weight of the children, and you can use different another formula. So, answer is 32 mg. Next, first edition of IP was published under the chairmanship of Dr. B.N. Ghosh. So, this you have to focus different editions of pharmacopeias, different what are the latest editions, in which year, and what is the chairmanship. So, this is the area which is focused since this is it is all the pharmacy oriented. Okay. So, Dr. B.N. Ghosh is the first chairman of the first edition of Pharmacopeia. Dr. B. Mukherjee, chairman of second edition of Pharmacopeia, and third edition Dr. Nityanand. Okay. So, the answer is Dr. B.N. Ghosh, B. Next option, next question, the test used to diagnose syphilis. Syphilis is a infection caused by bacteria and spreads through sexual contact. Okay. And Wassermann test is used. So, Richard's test, Fisher's test, nothing. Benzidine test. Wassermann test is the test which is used to diagnose the syphilis bacterial infection, okay, which are like source caused spread due to sexual contacts. Next question, publisher of International Pharmacopeia is obviously it's this International Pharmacopeia will be published by World Health Organization. Answer is C. Next question, dissolution test has been introduced in which edition of the Pharmacopeia? So, first edition, it is monographs, some 900 odd monographs in Latin language. Second edition, monographs from Latin to English language, and also introduction of certain analytical techniques like chromatography. Okay. Third edition, dissolution test, microbial limit test. Fourth edition, UV-IR, introduction of UV-IR spectroscopy. So, now see the dissolution test is introduced in third edition. Okay. First edition is monographs, 900 odd monographs in Latin language. Second edition is monographs in English language and introduction of analytical techniques. Third is dissolution test, microbial limit test. Fourth is UV and IR introduction. Okay. Apart from this, so many additions are there, other additions, important points. Let us see the next question. Number of carbon atoms in isoprene unit, very basic unit, basic question. See, isoprenes are the basic structural units of terpenoids. Okay. Structural unit of terpenoid, and this is the structure of isoprene unit, which is having 1, 2, 3, 4, 5. Okay. So, 5 carbon, C5. Okay. And with 2 double bonds, and it is having head and tail part. Okay. It is joined from its head to tail. Okay. So, this is about isoprene. So, answer is A. Next, first USP was published in both English and Latin language. Next, the repair and construction of joints is known as, say, arthrodesis is joining of bones. Okay, it includes repair, joining. Arthroplasty is the repair of bones. Arthrotomy is keeping incision in the bone, small incision in the bone. Amputation is cutting of the bone. So, repair and construction is arthroplasty. So, answer is B. Next question, which of the following is a wrong statement? Supplement to second, okay. See, supplement to second edition of Pharmacopeia of India was published in the year 1975. Yes, this is correct. First British Pharmacopeia was published in 1864. Supplement to first edition of Pharmacopeia of India was published in the year 1960. It is not 1966. First US Pharmacopeia was published in 1820. So, the option is C. Next question, which hepatitis virus is primarily transmitted through the contaminated food and water? Hepatitis is of different types, hepatitis A, B, C, D. Mostly contaminated through, contamination is through food and water is the first, hepatitis A. Okay, answer is D. Next one, which of the following law regulates the import, manufacture and sale of drugs in India? Okay, it is, see, Pharmacy Act is all about the profession, regularization or monitoring the profession of pharmacy profession. Okay, that is about done by Pharmacy Act. Narcotic Drugs and Psychotropic Act, the name itself indicates it is all about drugs and narcotics. Then Drugs and Cosmetics Act, this regulates the import, manufacture and sale of drugs, 1940. Medical Termination of Pregnancy Act 1971, that is all about the rules and regulations regarding the abortion of the pregnancy. So, here import, manufacture and sale of drugs is monitored by Drugs and Cosmetics Act 1940. Answer is C. Cover's gland. Next question. The drug ibuprofen belongs to which class of medications used to relieve pain and reduce inflammation? Ibuprofen belongs to NSAID, non-steroidal anti-inflammatory drug. Okay, it is not opioid. Opioid analgesics are different, and ibuprofen belongs to non-steroidal anti-inflammatory drug. Antihistamines not. Antihistamines proton pump inhibitors. Okay, answer is example for non-steroidal anti-inflammatory drug, that is propionic acid derivatives, ibuprofen. Next, cetirizine is an example of which class of drugs used to treat allergies and allergic rhinitis? It is histamines, antihistamines. Beta blockers, propranolol, ACE inhibitors, pills, calcium channel blockers, no. Antiarrhythmic drugs. Here the drug used for allergies is histamines, antihistamines. Okay, antihistamines. So the answer is cetirizine. Next question. Which of the following drug is a loop diuretic commonly used to treat edema and hypertension? Okay, so furosemide is a diuretic. Example of furosemide, bumetanide, it is a loop diuretic. Hydrochlorothiazides are diuretics, thiazide diuretics. Spironolactons, potassium sparing, diuretics. Mannitol is carbohydrate. Okay, so here the correct option is furosemide, which is a loop diuretic. Next question. What is the primary mechanism of action of opioids in relieving pain? Okay, so name itself indicates that opioids here inhibition of cyclooxygenase, not cyclooxygenase, they are NSAIDs. Okay, prostaglandins also. Then opioid activation of opioid receptors, opioid analgesics. Okay, not histamines. So here opioid receptors like mu, kappa and delta receptors are there. So answer is activation of opioid receptors. Next question. Glibenclamide is an example of which class of drugs used to treat type 2 diabetes mellitus? So glibenclamide, if you see biguanides, example is metformin. Sulfonylureas, dalbutamide, glipizide, glibenclamide, thiazolidines, pioglitazone, rosiglitazone, thiazolidine diones. Alpha glucosidase inhibitors, acarbose. So the option here is sulfonylureas, glibenclamide. Anti-diabetic classification of drugs. Next question is, the drug morphine is a potent opioid analgesic used for the relief of severe pain. Which opioid receptor does morphine primarily act on? See here, opioid receptors are three types. Okay, opioid receptors are mu receptors, kappa receptors, delta receptors. Delta receptor is also called as OP1, kappa is OP2, mu is OP3. Okay, this mu receptor is named after morphine. Okay, this kappa receptor is named after its ligand. So the ligand to which this kappa receptor, the ligand which is binding to kappa receptor. So that after the name of that ligand, it is called as kappa receptor, and that ligand is ketocyclazine. And delta receptor is named after a receptor in which the delta receptor is found first. So vast difference in this the delta receptor is identified first. That's why it is named after, delta receptor is named after vas differens OP1. Okay. So here what is the question? Morphine is a opioid analgesic used for pain. This receptor which opioid receptor does morphine primarily acts on? So that is, morphine is mu opioid receptor. Answer is A. Next question, the document, okay, so we will see, yeah, flecainide belongs to, so here these are antiarrhythmic drugs. So antiarrhythmic drugs are class 1, class B, class C, class 1A, 1B, 1C, class 2, class 3, class 4. Okay. So here this class 1 is intermediate sodium channel blocker. This is rapid sodium channel blocker, slow sodium channel blocker. Okay. Class 2 beta blockers, class 3 potassium channel blockers, class 4 calcium channel blockers. Okay. Here intermediate sodium channel blockers, disopyramide, quinidine, okay. Then flecainide is class 1C slow sodium channel blocker. Here class 1B is tokainide. Beta blockers, propranolol. Potassium channel blockers, sotalol, amiodarone. Calcium channel blockers, diltiazem, 𝐵. Okay. So you have to focus on antiarrhythmic drugs, classification, examples, mechanism of action. Very, very important. Okay. Next, mechanism of action of beryllium, it is potassium channel blocker. Beryllium is potassium channel blocker. Next, mechanism of action of 𝐵 already discussed just now, it is a calcium channel blocker. Antiarrhythmic drug with local anesthetic action is procainamide. Okay. 𝐵, no, it is only having antiarrhythmic action. This is also antiarrhythmic action. This is also having local anesthetic action along with antiarrhythmic action. Okay. Along with antiarrhythmic, it is having local anesthetic action also. It is a class 1A disopyramide. It is also having antiarrhythmic action only. So answer is procainamide. The drug is an anticonvulsant frequently, this drug which is an anticonvulsant frequently you see metoprolol, okay, sorry. Yeah. Okay, metoprolol, it is beta blocker. Mexiletine 1B antiarrhythmic. Phenytoin is a hydantoin which is anti-epileptic or anticonvulsant. procainamide is 1A, antiarrhythmic. So now see, let us see the question here, which is an anticonvulsant phenytoin, anti-epileptic or anticonvulsant, that is phenytoin. Now option is C. Next, gum consists of calcium, potassium, magnesium, all the above. Okay. So composition of gum is having all the 3, calcium, potassium and magnesium. Indian gum is obtained from Acacia arabica. Option is B here. It's Astragalus gummifer. Indian gum especially is Acacia arabica. Next, ferulic acid. Already discussed about ferulic acid. It is present in asafoetida. Is on treatment with HCl, it will form umbellic acid. Okay, it will form umbellic acid. So answer is B. In which plant trichomes contains resins? Trichomes, especially resinous trichomes, is a characteristic feature of cannabis. Okay, cannabis species, Cannabis sativum. Okay. So resinous trichomes, it's male fern, colophony, Indian hemp also called as cannabis. So answer is C. Indian hemp is cannabis species. Next, resins and gums are stored in old xylem tissues in plants. Yes. Resins and gum facilitates the transport of water molecules is no. Okay. So here the role of resins and gums is protection and healing. Protection, they are meant for healing, protection of plants, since they are secondary metabolites. So these are useful for protection and healing of the plant. That is why A is correct and B is wrong. Answer is D. Next one, clove is generally adulterated by clove fruits, blown cloves, clove buds. Actually clove which is having local anesthetic action also, clove buds are the maximum drug content containing original clove is clove bud. So these are adulterated by clove fruits and blown cloves. Blown cloves means all the volatile oil content is extracted and it is dried again. So these are fully buds extracted exhausted cloves. Okay, exhausted cloves. So volatile content is removed and dried. So these are, and fully blown cloves, fully bloomed ones. So all these are adulterated parts of this clove. Original one is only clove buds. So clove fruits and blown cloves are the adulterated ones according to this options. So A and B is the answer. Fennel belongs to the family. Here fennel belongs to Apiaceae family, also called as Umbelliferae. Answer is D, Umbelliferae. Absorption of visible and UV radiations is associated with vibrations and rotations are IR, infrared. Excitation of electrons. So here whenever the UV light rays passes through the molecule, okay, UV rays passes through the molecule, the electrons will get excited. Okay, so this is a UV visible absorption spectra. So the absorption of the light rays by the molecule is measured in UV absorption spectra instrument. Okay, so the molecules will get in the molecules the electrons will get excited. During this process some amount of energy is absorbed, energy from UV source. is absorbed and electrons get excited, and the rest of the energy is reflected back. So, that absorption is measured. That is why the excitation of electrons is the correct option. Resonance, this concept we see in Raman spectroscopy, nuclear magnetic resonance NMR spectroscopy. Okay. So, only correct option is here C. Which of the following is a violation under Pharmacy Act? Dispensing of drugs without supervision of a registered pharmacist, selling drugs without prescription, selling is important, manufacturing, imports. So, all this selling of the drugs, manufacturing of the drugs and importing of the drugs comes under Drugs and Cosmetics Act 1940. So, all these three are monitored by Drugs and Cosmetics, comes under drug violations of this comes under Drugs and Cosmetics Act 1940. So, the only option where Pharmacy Act which monitors the profession of pharmacy. So, here selling without supervision of a pharmacist comes under the violation of Pharmacy Act 1948. So, correct answer is A. Match the following. Last question here. See the biological source. Gingiber officinal, it is ginger, name itself indicates it is Gingiberaceae. So, A is 2, A is 2. So, this is wrong. Next. Capsicum annum, capsicum is a Solanaceae family. So, B is 1, B is 1. So, these two. Again capsicum annum, okay. Here it is cannabis, okay. So, Cannabinaceae family. Ipomia also called as jalap, which is a purgative. This is Convolvulaceae family. D is 3, option is A. Okay. So, here the paper discussion is completed. So, if you have any doubts, just communicate, okay. And again I am remembering here a fresh batch is going to start. So, whatever the queries, you can contact the number given under, okay. Okay, thank you.